it's so absurd because the thing is we have the capability to just look inside someone's heart and say, do you have heart disease, right?
Mhm.
And then heart disease isn't just a catch-all term, right? As we know that there's different types of plaque, and what people don't realize is that I think even for like early medical students and physicians in their early stages of training, they think that heart disease it's kind of like a pipe that gets clogged, right?
Right.
It's like after years, you have so much gunk that gets stuck in there that the diameter slowly closes and nothing can pass. And then that's what causes a heart attack. But it's really the development of something called soft plaque.
Dr. Patel, thank you so much for joining me. I'm looking forward to this. I'm glad Jeremy connected us. The first thing I have to ask, and I always start off interviews with a random question, is how is Zion National Park in Utah overall? It's a state I wanted to go to.
Yeah, now, you know what? That's the second time I've been there. And I swear to God, every time I go to those areas, and I've just recently started getting more into the national park system in our beautiful country. And I'm like, my God, I can't believe I haven't been to more of these earlier. And we got to do our first hike with our kids there, and it's just so beautiful. We were very lucky that the weather, worked out for us. But no, Zion was just gorgeous, man. I can't wait to go back again. We hiked the Narrows the time that I went previously, which was a pretty intense experience because we went in like December, I think, and it was really cold. But it's one of those things you go back and you're like, man, that was pretty awesome.
Yeah. What is it that got you, I guess, interested in national parks?
Yeah, I had a group of friends that, they've been going for years and like, oh, you got to come with us. You got to come with us. So a few years ago, we started, joining their trips, and I'm like, all right, you guys got us hooked. So now we're all into hiking and getting out there and trying to plan family vacations kind of around national parks. I think going to see the redwoods is going to be the next thing on the docket.
Yeah, I haven't done too many national parks, so that's something I need to get to. Have you been to Utah in the winter?
I have not. We're going to go this winter though. We bought our pass, and we're going to head out to the mountains out there because my wife just picked up skiing, and I got my kids into snowboarding last year. So I think we're going to go from the little hills of Wisconsin out to the mountains in Utah this year. So
yeah, see, that's the final frontier for me. I don't have a winter sport. I was speaking to a previous guest about this, that it's between skiing and snowboarding. I think I'm going to do skiing. I think I am, but I can be convinced to do snowboarding instead.
Yeah, I mean, look, they're great either way. I mean, I think they say that snowboarding is a little harder to learn. I think they're both kind of difficult to learn at either point. But, I've lived in Chicago for 40 years, and I just detest the winters. So finally having something to look forward to in the winter by having a winter sport makes it a lot more, tenable. So I'm like, I wanted to get back into this a little bit more, bring the family back into it. And now we're all kind of excited to head out and do some stuff in the winter.
Yeah, that's understandable because you've actually experienced real winter. See, I'm in Nashville right now.
Oh, okay. Yeah. So you get a sprinkling of winter every now and then.
Yeah. And I'm sure you're familiar that in case the threat of snow, a light dusting, the whole city shuts down.
Yeah.
So speaking of Chicago, I saw you went to school at Midwestern University as well. Have you always wanted to be a physician?
It's funny. So my parents, they immigrated here from India, and it was kind of bestowed upon me that I would become a physician, right? I was like, Dad, I want to go to investment banking. He's like, no, you should be a doctor. I'm like, Mom, I want to go into business. She's like, no, you should be a doctor. So it was kind of told to me very similarly to many other Dr. Patels of the world that we were going to be physicians. But yeah, I couldn't really fault my parents for wanting me to do a great profession like being a physician. So, I acquiesced, and obviously it turned out to be a great decision. I thank my parents for their support and all of that. But, I did have kind of a tenuous relationship with wanting to be a physician because I always had a bit of an entrepreneurial spirit, and much of my family, it was really, there's only a few professions you were allowed to be. It was like physician, engineer, pharmacist, or entrepreneur, right? That was kind of the entire spectrum of all my cousins, uncles, everybody. That's kind of where we fell. And as I, progressed through my medical career and everything, I kind of always maintained a little bit of that entrepreneurial spirit. I worked as a chief operating officer for an early stage health tech startup for a few years. I worked for a pharmaceutical company as a consultant. I do medical legal expert work when I was a hospitalist previously. So kind of dabbled in a lot of things. I built and sold a brick and mortar business. So even during my tenure of being a physician, I kind of still branched out a little bit.
Yeah, I have friends who share the similar thing of you did, that in terms of you can be anything you want within these 4 choices.
Yeah, exactly.
and I asked them, I see the benefits of that, but I'm curious with your kids, do you think you'll do the same thing or not? Or will you slightly nudge them or really let them just pick?
No, that's actually a very loaded question because I'm ripping my kids out of school next year. Because I don't actually think that the education system's like primed for what's about to happen with the disruption of AI. And I don't think that sitting in a traditional didactic setting is the appropriate way for them to move forward, such that like the skills, right? Like if you told me that you could drive from Nashville to Chicago without using a map or anything, it's a great party trick. But no one cares because I could pull out my phone, I could pull up Google Maps, and I can navigate to anywhere in the world. So the utility of memorizing maps and navigation is really lost, right? Like somebody knows how to use a compass, you don't really care, right? But now imagine that with all of knowledge ever, right? It's you have a PhD level guide, tutor, instructor in your pocket all the time, like immediately accessible, never fatigues, always ready to answer every question. Now it hallucinates. People hallucinate, right? So it's the idea that there is no longer, right? We used to we had this pathway that would go from education to higher education to the workplace, become a professional, define your purpose in life, accumulate enough wealth, and then sit on a beach and retire, right? That's kind of the paradigm that we had. Well, now it's no longer that in my mind. I think that we're shifting to a point where, but I envision the time when my children are 18, that as I pull them out of school, what I'm actually doing is developing, I have Elevate Health. I'm actually developing Elevate Academy, which is, I'm going to create this area where children will have 3D printers, Raspberry Pis, robotic kits, and then just general AI courses. And so this will be a community where kids will come in, we'll have instructors that will kind of give them a little bit of guidance and then some free time in the lab. Really, it's kind of letting kids explore their own innate curiosity with what is the material that you like, right? It's okay. I want to make a t-shirt. I like clothes. I like cool. Okay, let's explore that. You've made a t-shirt. Well, how would you go about selling this t-shirt, right? How would you make a business plan? How do you create a website? What is a payment rail, right? These are terms that are usually held off for people at much different levels of, their career, where it's like, you're not going to talk to a 12-year-old about payment rails, setting up Stripe on your website. But what if we could, right? Like what's holding us back from doing that? Because I think there isn't really anything left in the idea that you can just do whatever you want, right? Like, I might not be an educator, but that doesn't hold me back from the idea that I don't think I can educate my children appropriately in a world where we can integrate these two new types of tools to get them prepared for what I think is going to be a very different world 10 to 15 years from now. Like me as a physician that took 11 years to get here, patients constantly, like friends and family always ask me questions. I literally copy paste their text message into ChatGPT. I look at it, I'm like, yep, that sounds pretty much right. I didn't have to write out that long response and I give it back to them, right? It's like a lot of the utility for this initial level of evaluation is gone, right? Like I think OpenAI just released Health Bench yesterday, which is, their ChatGPT with 226 physicians. They created this entire health, library and, all the metrics that they start assessing, through all the different LLMs, whether it's Grok, Claude, ChatGPT, everything, their metrics are better. They're better than humans, right? When they come to diagnosing, they're not going to have sleep deprivation like I will. They're not going to be, they might not have had a fight with their spouse, right? Like they're going to be perfect and they're going to be consistent all the time, right? Yes, they have problems. And, I think the one thing that saves me is I still pay malpractice insurance. So you can sue me, but you can't sue an LLM. So I'll have a job for a little bit. But that's the idea, right? You think about I haven't used a lawyer for initial stages of things for a while. I'm just write a business agreement quickly that I'm going to start something and then we can get it more codified when we get to a later stage, right? So it's funny how we went from this big progression away from blue collar jobs, pushing everybody to white collar jobs. And some of the first things to go in this new iteration of the post AI world are going to be the white collar jobs. And they're going to be a reversion back to this, hands-on type of economy, right? And so part of what I want to create in this and what I think what a lot of people want is now as we get, attached to screens and we have a lot of virtual things going on, we've always wanted a place of community, right? And I think that's kind of what I really want to push forward with Elevate Academy is the idea of community and community with children, right? The tagline that I have is country club for nerds or Y Combinator in a strip mall. Because it's give these kids the ability to do whatever the heck they want. Put them around other kids that feel like they can do whatever the heck they want. And then see what happens. Like we've seen it in Stanford and all the other like incubators and tech startup hubs. Like, look at that. You get a bunch of committed kids together. You say, look, we're going to provide you the resources to help you succeed and give you that positive environment. And look at what they like, how many unicorn companies have come out of Y Combinator, right? Like, you know, how many amazing things have come out of the Thiel Fellowship. So it's strong leadership and guidance in the appropriate environment that I think leads to some amazing results. And, you know, it's funny because you asked about, you know, I think of that relevance between my parents leaving a country with nothing, coming here in the 70s with no money, no job, right? And like dealing with, you know, a different environment of being a colored person then than now, right? And all so that I could have a better life, right? Obviously, that was for them, but like really, like, you know, I have 2 kids that are 9 and 10. That's like, most of the things I do are for them, right? We really try to pass on what we can. And, you know, this is kind of my iteration of that, right? It's like, I'm not leaving this country to go somewhere else, but I'm leaving this current education system to put you in something that I think is just, you know, as difficult in a sense of like, well, it's easy for me to say bye. The bus will pick you up at the end of our cul-de-sac, and then I'll see you 8 hours later. Because I think that, you know, it's kind of like almost like a daycare, right? So it's like, I don't have to worry about it. I have to think about it. But now like people are like, what are you going to do? What are you going to teach your kids? And I'm like, well, I don't know. But like, I do think that, you know, there's so many examples of this. But, you know, I think that, you know, with a certain amount of structured time where they're just not held to a common core curriculum or standard amongst all their children, they're pushed to the level that they can achieve. Well, then in 2 to 3 hours, they could do what they would have done in 8 hours in a different setting. And then I'm like, okay, let's get a voice coach to come in and help you with public speaking. Let's get your golf coach to come in and help you work with this. Go play video games for an hour. I don't care. Like, you've done your work, right? Like, there shouldn't be such a distinction between work and play. Like, we have to find the thing. I mean, Neville Ravikant is a guy that I like a lot. And, you know, he's always like, when you can find the thing that blurs the lines between work and play, you win, right? Like, there is no goal of retirement. It's just a goal of happiness. So just start there and work backwards and then kind of find your way. Sorry, I know it's kind of a long-winded answer to your question.
I love that, because I see so many parallels between actually health and actually what you just talked about. And, you know, I don't have kids yet, but I do something what I call future thinking. And so I really like to think about this. And I thought about this in terms of myself with my career and where it's going, right? Because I've always felt like, well, I'm not a physician. I didn't stay in medical school, but I'm not this thing neither, right? And so, but where's the world going? And for a lot of people, I think if you don't have a highly specialized field, you're almost going to be kind of like this hodgepodge of different things, right? But maybe there's a core nucleus. Like for me, the core nucleus is still health, but that is expressed through so many different means. And that's kind of how, you know, and what you said earlier, if you do that work, it's not work, it's enjoyment, right? So this is fun. We're just talking, and who knew about homeschool? But I'm curious about that, because I do think about that a lot in terms of the health field. A lot of times ideas are from mainstream are about 10 to 15 years behind. And so the educational system at some point will definitely have an overhaul, but is it going to be 10 to 15 years later again? That's the thing I'm thinking about, because it's an outdated curriculum.
But no, I completely agree. And like the idea is that, you know, it's my kids are 9 and 10. So if their delay in introducing these massively leveraging tools like artificial intelligence, LLMs, is delayed till they catch up, till maybe high school. And how do they compare to the kid that got it 5, 6 years before or 7 years before? They're already so far behind. Their minds are like sponges, right? Like, it seems like such a disservice to me to not give my children the opportunity to, you know, work with a technology that is probably the most disruptive thing to society since like written word, right? I think that, like, I've listened to a lot of podcasts about this, and I think that was probably the most apt description, because I don't think there's anything as revolutionary to this time point than that, right? We've taken out a piece of what defines us to be human and given it to a technological base. And so then we have to kind of redefine what it is we do, right? And I think so much of what we defined previously in purpose was our profession, what we do on a daily basis for 40 hours a week, right? But now purpose is not driven by what you do. Purpose should be something that's inherently driven internally and then expressed outwardly. And like, if you're if you're just doing something to make money, that's fine, make money, but then also just know that money isn't the purpose, right? Money solves money problems. Money doesn't solve life problems. So you got to figure out what life problems are, make sure you have a plan for those, and then get the money to take care of all the basic necessities. So I think helping my kids understand that paradigm shift is huge.
And speaking of making a leap here, what made you leap into what you're doing now compared to being more in the traditional healthcare system?
Yeah. So, I mean, I practiced traditional healthcare for almost a decade, right? And so I was in it. I was a hospitalist. So I got to really see the inner workings of, how the hospital works and all that kind of stuff. And it was rewarding and I enjoyed it. But then COVID came along and that was a really difficult period given, the amount of like death and destruction that was occurring during those 2 years. But after that, I kind of took a step back and said, is this really how I see myself for the next few decades of my life? And it was at that point that I decided I kind of needed to reevaluate how I viewed medicine, how I wanted to help people in their health journeys. And, I kind of went on a personal health journey. And I think that's for many people is like, it starts with yourself and having 2 young children, going through COVID, probably drinking way more than I should have. And, just putting on some weight and all that kind of stuff. I decided I needed to get that all back together. And then kind of from there in my trials and tribulations, I kind of had learned a process about how I thought this would work. And then I helped coach a few people on the side while I was still working. And then after that, it kind of began to pick up a little bit steam. And I thought, you know what, maybe this is the thing that was really more aligned with my calling. And then, that was about 2.5, 3 years ago. And then it's kind of just snowballed since then.
Yeah. So I'm curious, the company name Level 8, what's the
yeah, I thought it was cute, right? And like this happens all the time, but it's Elevate because it's supposed to be like Elevate Health, right? So just trying to take your health higher, and it's also like trying to figure out the best domain that you could buy, right? But no, I was like, I always wanted to like see because it's like everything that we do for our health is as the baseline, like the bare minimum, right? Whatever we get for barely passing is our standard of health because healthcare is dictated by who? The federal government and for-profit insurance companies. So do you think they want the best thing for you? Or are they trying to adjudicate care for 400 million people or answer to their investors quarter after quarter to being like, we're making more money? So that's not elevation of your health. That's like, okay, you're not going to die tomorrow, probably, right? That's kind of, and so I'm like, okay, what happens if we shift it the other way 180 degrees and say, what if you spent as much money as you had to elevate your health to the highest extent possible?
I think there's a term now. It's some people say medicine 3.0, some people say longevity 3.0. Someone comes to you that's unfamiliar with this. They've been stuck in the traditional healthcare system. How are you going to describe this to them? What would you tell them?
Yeah, so I came up with there's the 3 Ps, right? Personalized, proactive, preventative, right? So the idea is that everything we used to do, right? If you ran a business and you said, my business is my lifeline, right? This is what provides the roof over my head. Would you go check that business once a year and then say, oh, how's business? I don't know, it's okay. And then leave and not come back? Like that's the most ludicrous sounding thing. Well, for most people, health is a pretty important part of our life equation, right? But that's what we treat it as. And so what would happen if we treated our health as a business? What if we took that same level of metrics that you hear in the corporate world with KPIs and, quarterly goals and all that kind of stuff and applied that same rubric to your health? Well, then we would be entering the idea of medicine 3.0, right? We would be saying, okay, let's use data, personalized data to you, consistently monitored in a dynamic fashion to get you to the place that you need to be with your health journey. And so it's not just, oh, okay, well, that doesn't look bad. That's okay. That's okay. No, it's like, how do we optimize that? How do we optimize that? How do we make it better? There's always room for improvement, right? Everybody has room for improvement. And the more, and it's the idea about compounding effects. We all understand compounding interest when it comes to our bank accounts, but somehow we don't understand with our health accounts. That if you start making these really good decisions at 35, 40, 50, then when you're 80, 90, you're going to be much happier and much more content with your quality of life because you've made those investments early. And so it's kind of the way I really like to use the analogy of a business and your health to kind of help people understand, like, we got to take it more seriously and we have to apply a lot more data and metrics and monitoring to it, right? I'm like the accountability guy. I'm the cop at the end of the street, making sure you don't speed or, you said you were going to work out for a week and you didn't do anything. Why not? It's not okay just to say I didn't feel like it anymore, right? So that's a big part of it is, really having that relationship with my patients. I talk to them every 2 to 3 weeks, and their plans remain dynamic to make sure that we can adjust to whatever life throws at them.
Yeah. And, to piggyback on what we talked about earlier with the AI and the data, this frees me up to do those types of things, to really develop that relationship and get to the core of the issues of what's really blocking people. Because a lot of times, and I'm sure you've known this by now, someone could have, they can be pre-diabetic, but a lot of times the reason for that is a life problem per se, right? And a lot of times if you're just going to visit at a primary care physician, you get 15 minutes to discuss this, and you're not going to get to the root. You're not going to get to the actual root of what's causing this for this person. He might be having marital troubles or whatever, right? And I think that having that data now, having these large language models helps with that. And that's where humans can really thrive now, to bring more nuance into it, interpretation, accountability. And I think that's the beautiful thing now with the new model that's coming, and probably is going to even grow from here.
Yeah, no, I completely agree. I mean, I think that, and we're just scratching the surface now, right? Mm-hmm. It's not that we have so many beautiful applications and programs that address the things that you just mentioned, but I think that we're on the cusp of those coming out within the next 12 to 18 months.
Yeah.
Go ahead. Sorry.
Yeah, I'm curious. Go ahead and finish that first, and then I was going to go to something else.
Yeah, no, I was just going to say that, a lot of these things we're going to see in like large corporations like Whoop and, other, health biometric data tracking services are going to be integrating these things to provide that nudge for you. Because it's like, if I slept poorly on my 8-sleep mattress, I'll get a notification, right? And then like if it's tagged into my Whoop, so there's this entire ecosystem that we're going to be building that's a consistent monitoring system, right? And the more active and dynamic data we have, the better we can make sure that we're adjusting what you need to do on a daily basis and not waiting like until 10 days pass before we make any adjustments.
Mm-hmm. Yeah. So I have a question here. This is devil's advocate, because somebody posed this to me recently. I have a Whoop on right now, and I was in the red, and they were like, well, are you just going to cancel your workout or not do it? I was like, no, I'm still doing my 2-a-days today. And they were like, why? Because it's like, I feel pretty good. I know my body really well. Right. And so the question was pretty much essentially is, sometimes there's risk with now over relying on data and devices to let that control us now. So how would you recommend people to balance tech with still intuition and human judgment?
Yeah, no, that's a great question. And I think unfortunately this comes back to like the current state of our society with social media and the internet and stuff. It's like we've lost nuance. Everyone's like diametrically opposed to either side. It's like, it's red, it's green. It's like, no, dude, like, okay, it's red, but you feel okay. And, you might have had a slight extenuating circumstance and you're like, all right, maybe I'll cut it down by 10 or 15 minutes. And then you're like, oh, I still feel good. Next day was better. And then you've learned that when I felt good and I had a red, it's still, because you're the ultimate LLM, right? You're supposed to be the thing that integrates all the data. So use your nuance, use the fact that you have this amazing mind to then discern that. And the other thing though, is you are probably more in touch with your body and your assessments of these things than others. So I think the biggest thing is to understand these numbers as a guide, as general trends, as not certain things are absolute, right? Like if you're wearing an Apple Watch and it shows you have AFib, you better go get that evaluated, right? There's really not a lot of black and white on that. But it's like, to your point, and my sleep score is down a little bit, I'm not going to freak out. I'm going to understand. Maybe there's some things, maybe I could have improved this. Maybe it was a fluke. Who knows? But you shouldn't live and die by the number. It's simply use that as a reference and a framework and move forward.
Yeah. Yeah. For me, it was a large meal too close to bedtime.
Yeah. Yeah. So I fall victim to that every now and then too, man. I get it.
Yeah. Yeah. So normally if I stop eating around 5:30 or 6, it's great. Like it's a huge difference in my respiratory score, heart rate, HRV and everything. It's quite fascinating. Just something as simple as that. So making this shift is, you go through medical school, you're taught a certain way, you're taught a certain paradigm, and then you're essentially kind of breaking that paradigm right now. And so that has to, one, a removal of the ego, right? And there's also a philosophical shift there. What do you think's the biggest thing stopping other physicians from kind of seeing this other paradigm?
It's funny that it's a great question because, I was the other person, right?
Mm-hmm.
I was the person foo-fooing anything that didn't fall in line with the dogma that I was taught, right? It's like, this is evidence-based medicine and this is the way
Mm-hmm.
that it should be. And we need to follow the guidelines, and the American College of Cardiology said this. And then you're like, okay, that makes sense, right? As just a young medical student, you're looking up to all your mentors and peers and thinking, all right, this is, we've treated people, we've created this amazing medical system based on these things, and we've progressed, and we've our 5-year survival rates for these cancers have improved by 35% with the introduction of the blah blah blah, right? And then you're like, oh, that sounds great, but that's population health data.
Mm-hmm.
You're just an N of one, right? Like, all that stuff could make sense for those thousands of people, but you could be the exception, right? Or it's just the idea that we don't always know. And I think the biggest thing, to your point, was it's the removal of ego, and that we don't know that much we know less about the human body than we do know about it, right? Like, think of the brain, right? We're like, wait, we think that this area generally controls speech, but it could be different for the next person. Or it's like someone strokes out, 2 people have a stroke in the same place, and they can have different physical symptoms. So for me, it was really kind of reevaluating what I think is going to be the most beneficial thing for my patients, and not necessarily saying we need a $50 million FDA funded study for this to have validity. Mm-hmm. Because if my patient's like, hey, this works, and I'm like, good, it looks like it's working, you're staying committed, all these metrics are improving. Well, in my mind, it works. Like, what else do we need? It's like, well, the next 8 people it didn't work in. Okay, but for my patient, it works. So then who's right? Right? It's like I think today's medicine, we want it to be more applicable for the masses, which is understandable. And we have to figure out a way to, make sure that everyone in this country gets healthcare to a certain extent. But we're now learning, and we have, because of our technological advances, because of our access to different resources and facilities, we can now apply this level of individualized medicine. And yes, it still does self-select to a specific cohort of patients that have a socioeconomic status now due to the costs associated with it. But as that group gets more entrenched in these ideas, then it'll start helping to access that technology to more people. Like Cleerly started off as $1,000 test, and now Medicare just approved it. So think about it, right? It's like, if it wasn't for those early adopters, it would have been hard for that company to then get the funding to then proceed to do all the studies they needed to then tell Medicare and payers that, hey, this is worth it.
Mm-hmm. Yeah, and that's what I tell people a lot of times about these types of services, because a lot of times these services are not maybe accessible to the masses yet, right? Because there's a cost for it, and but over time it will be, and that's a prime example. I think you can get full body AI scans, mm-hmm. and those costs have dramatically gone down. Genome testing has gone down dramatically compared to what it used to be. And so that's the good thing. And you need these early adopters. And so I think we'll shift now to more granular topics now. And I think the first one we'll stop with is annual testing, mm-hmm. and how it's around 90% a lot of times that you can miss things in those. I forgot the actual number with that, but I'll just leave that up to you. What do you think about annual testing and kind of the downfalls of that? I have my own opinions, but I would love to hear yours.
Yeah. Well, I mean, I think the problem is the first word, annual, right? Yeah. It's like, my testing is like bi-weekly, like once a month at least. And the idea that a testing is a conversation, right? A testing mm-hmm. is, because my goal is like, so the way that my clinic is structured is like, we have the 4 pillars of daily life, right? So it's fitness, nutrition, sleep, and mental well-being. Mm-hmm. But all of our other tests then revolve around, the icebergs of heart disease and metabolic disease and all that kind of stuff. So if we're going to check metabolic disease once a year, that would be precluded on the fact that you ate the same thing the entirety of the year, right? Like, that's mm-hmm. kind of absurd. So if there was a consistent level of something for a year, then fine, annual testing is prudent. But if we don't act the same way every day, then annual testing is absurd. And I don't think that there's really another way to put it. I don't even know, if you're just trying to make sure that people might not die, then that's okay. But anything beyond that is just a complete disservice to your own health, right? Now I think the thing that we've lost, and what I tell everybody is I don't care if you stay with me for a year or 20 years, but even if you stayed with my clinic for a year, after you leave, I'd love for you to just have some autonomy and agency over your own health, mm-hmm. for you to feel informed, for you to feel educated on how to interact and how your body works, and you're making better choice. Like, I still get, text messages from patients that, like this one guy who moved out of town and he found another physician, but he's like, look, man, I'm still always eating my 2 eggs and my yogurt in the morning because of you. And he'll send me pictures randomly. And it's like, it's that consistency. It's right. That education. So if we think of it as annual, we've lost. And I think that's my biggest issue with it, is that there's no way that something as important as this can go down to once a year.
Yeah. And in doing that way, you miss so many of the early issues, yeah. and I think one area we can start with the heart health and how we think about that. Both our population groups are pretty hard hit when it comes to this. And so when you think about heart health, what's your, what's your framework? Do you have
Yeah, I have a framework, and I'm like, this is my soapbox, the hill that I will die on, that like, this is the most absurd thing that we do in healthcare today. Because, for the people that might not understand listening to this, we check cholesterol, which is an ancillary marker for the assessment of heart disease. So somebody says, you have high cholesterol, you have a higher preponderance for the development of heart disease. Okay. So what does that mean? Well, okay, if we calculate something that'll give you a 10-year risk score, and because you're a smoker and your cholesterol is a little high, you have 4.2% risk of heart attack in the next 10 years. All right. So what does that mean, doc? It means you have a little bit more risk than the rest of the population. So what do I do? Take a cholesterol lowering medicine. Okay, so how much heart disease do I have? Oh, I don't know that. I'm just saying that you might have possibly a higher risk. Okay, well, it's so absurd, because the thing is, we have the capability to just look inside someone's heart and say, do you have heart disease, right? Mm-hmm. And then heart disease isn't just a catch-all term, right? As we know that there's different types of plaque, and what people don't realize is that I think even for like early medical students and physicians in the early stages of training, they think that heart disease it's kind of like a pipe that gets clogged, right? Right. It's like after years, you have so much gunk that gets stuck in there that the diameter slowly closes and nothing can pass. And then that's what causes a heart attack. But it's really the development of something called soft plaque. And, the way that I really tell this analogy to people is, imagine a crack on the sidewalk, right? A split in between the seams of concrete. Well, if you threw a basketball at that, it would hit the crack and bounce off, right? If I had a handful of tiny little pebbles and I threw them at that crack, guess what? A few of them would get stuck in there. Well, how did that crack form in the sidewalk? Well, it could be tension, whatever, but that's like our body. So if you have heart disease, an inflamed state, the interior part of our vessel can get torn. And then think of that handful of pebbles. Well, that's the small LDL particles. Well, guess what? All in a basic lipid panel is how much LDL you have. When I get an advanced lipid panel, then I do a lipoprotein fractionation. So then I say, okay, what is your LDL particle size? What is your LDL number? So then that essentially tells me, how many pebbles do I have in my hand and how big or small are they? Because if you can imagine, if I had a ton of tiny little pebbles, the possibility of getting stuck in the crack is much higher. But if I had if I had fewer larger pebbles, then lower probability. Okay, so then we've done the advanced lipid panel to understand, okay, what is my true risk with my cholesterol breakdown? And then after that, we say, okay, let's just go inside and take a look in your heart. Now, the problem is this is a cash-based procedure. So you're looking just under $2,000 to get this done with the 2 steps of the CT coronary angiogram and the Cleerly analysis. But after you do this, then you have a true risk assessment of where you sit for the development of heart disease. It is the thing that kills more Americans than any other disease in the country. And yet we're sitting here like, I don't know. And then everyone's like, I need the PR marketing campaign people that are anti-statins, because they've crushed it. Statins are probably one of the most amazing medications to hit the market in the last 40 years. That, I talked to cardiologists and cardiothoracic surgeons that would practice in the 80s and 90s and talk about people just coming in, dying left and right. And statins completely changed that paradigm over decades. But it was one of the most widely prescribed drugs and people got side effects. Well, yeah, that's going to happen, right? But, there's been a negative connotation to that. So, we get this appropriate assessment, clearly tells us exactly how much heart disease you have, where it is, what type of plaque it is, right? Because the thing that, as I was alluding to earlier, is it's not the gunk that gets stuck in the pipe that causes a heart attack. That soft plaque comes. And then the soft plaque, which is those little bits of particle, those pebbles that get stuck in the crack, and they start to coalesce and they create this little structure. And over time, it can become calcified, which actually means it's like concrete that is cured and is now stable, which is great. But on the earlier stages, it can rupture. And when that soft plaque ruptures, what it does is it releases these particles and it activates something called cytokines. The cytokines will then cause platelets to aggregate. And that's why everyone tells you to start chewing aspirin if you have chest pain, is because it breaks up that platelet clot. And people think, it's like, oh, Mike was so healthy. He was running marathons. He was only 50 years old. How did he die of a heart attack? It's because Mike had a little bit of soft plaque right at the beginning of his left anterior descending artery that popped at a very inopportune time, right? But Mike never knew that because Mike was healthy and Mike had no concern. But Mike wasn't healthy. Mike just didn't know. And we stick our head in the sand because, well, the current healthcare system doesn't think I need to. Well, I don't care. Like, if you told me that this is the thing that is most likely to kill you and all the people around me, you better be darn sure that I'm going to be figuring out as much as I can about what the hell's happening in my body to make sure that I don't end up that cautionary tale.
Now, I'm sure someone's wondering, soft plaque, what is soft plaque? How do you even develop this plaque in the first place?
Yeah, so that goes back to that crack in the sidewalk. So those pebbles that are getting stuck in there, that's the formation of the soft plaque. That's the LDL that is kind of coalescing and coming together. Now, over time, more and more of them will pack in. So that little soft plaque will just kind of solidify over and become calcified. But in the early stages, right, if you have high blood pressure, different things, that plaque can rupture. And then when that plaque ruptures, you're in big trouble.
So would you say if there's someone says, hey, Dr. Patel, I'm worried about, I don't want soft plaque to develop. A lot of this is attributed to lifestyle factors.
Correct.
Right. But then what about those people who are, some people are maybe predisposition for higher cholesterol, right? Or I forgot the name of it. I forgot the actual name of it.
Yeah. Familial hypercholesterolemia.
Yeah. Yeah. What about those people? Would they have a higher propensity to potentially develop that soft plaque?
Absolutely. I mean, it all kind of starts as soft plaque and then moves towards calcified plaque. The beauty of this is, like, right now, if you go to see your doctor and they're like, oh God, we did, your cholesterol's through the roof. It doesn't look good. Take this cholesterol lowering medicine. And like, oh God, your cholesterol's better. Great. It doesn't give you any more data. Now, if you saw me and I said, your cholesterol's high, we did a Cleerly scan and we see soft plaque in these areas. And then you take the medicine for 2 or 3 years, we would do another Cleerly scan and I could say, look, all that soft plaque has calcified. The total amount of plaque in your heart has decreased overall. These areas of narrowing have slightly improved. And the goal is, we're not going to get rid of the plaque. But if you died with a tiny amount of plaque in your heart at the age of 103, who cares, right? The idea is that you don't die of a heart attack. Right. And we have to mediate the intensity of our therapy based on appropriate data. And that appropriate data is a Cleerly scan. And then we use the advanced lipid profiles as guideposts throughout the monitoring process to make sure that the patients have the right levels that they need.
Yeah. I'm curious to go back to the stats real quick, because I've talked to a lot of people who are against them and a few who are for them, right? So I've heard both sides of the debate on this. What's your reasoning that you think that are you a proponent of it more so?
Yeah, I mean, I'm a proponent of the thing that stops heart attacks for millions of Americans. I mean, like, the people who say no to statins, I have like significant concern for their medical qualifications, right? It's like, you can't take away, it's like one of the biggest interventions for this. Are there other opportunities for you to maybe improve those things? Yeah, maybe there's a bunch of stuff out there that I'm completely unaware of. But until that becomes publicly known and there's a bunch of data that shows that it's going to be just as effective in saving my patient's life, that a medication's been around for 40 years with millions of patients of lives data associated with it, I feel like, I don't know. I feel so strongly about this that it kind of, I don't understand the anti-statin movement unless you give me a better reason, right? It's like the only reason they have is I don't like statins. Okay, great. Now what? You're just going to die of a heart attack?
If I remember correctly, I don't remember the exact study or whatever, but I think one of the conversations I had, it was around, I think they came up with that it didn't actually extend life as long in terms of longevity.
Yeah, but like, that's like, it's not about that, right? I mean, like, the thing is, it's like you can start messing with all these stats within these studies however you want, right? Like, okay, it didn't extend the life over 100,000. I don't even know that that's true because I don't even know the study that you're referring to. But like, the idea is, like, let's just say that there was a study that stated this, right? You have to understand what the primary endpoint of the study was the secondary endpoint? What was the analysis, right? Like, if we all agree that soft plaque can kill you, right, and having a lot of plaque in your heart is bad, then The number associated with how many years that it extends life beyond in a study is immaterial.
Mm-hmm.
I told you Julian, you have a bunch of soft plaque in your heart. Like, all right, well, I don't want that. Well, it's like, okay, I can give you this drug, but it might not make you live longer, or it might stop a heart attack or stroke. Like, what if you still lived at 100, but you had a stroke at 80?
Mm-hmm.
You would have technically still lived the same, but you would have had many different years without the stroke, right? So it's like people confound the idea of study endpoints with what's really utilitarian in our current construct. And I think that's kind of the medicine 3.0 thing.
Mm-hmm.
So a lot of the medicine 2.0 people will be like, well, I don't know, but I'm like, well, that's okay, but it's not the point. The point is, are we reducing the risk by the only tool that we know that we have? Then yeah, then I mean, let's use it. Until you give me something better that absolutely works, I don't know that I'm going to tell my patient not to do something they don't feel like it. I'm like, no, this is the thing I'm going to say you should probably do. Obviously, if you don't want to do it, I'm not going to say you have to do it. But there's even studies like, statins increase your risk of dementia, and these are all, if you look at the grades of evidence on papers, these are all retrospective analyses. So it's like the lowest grade of evidence, and then one study says it's positive, another debunks it, and so it's like, okay, well, yes, we're all scared of developing Alzheimer's dementia, but like, don't you want to at least live that long to get the chance to develop it? Because if you're probably not going to get dementia at 52. So
yeah,
it's like,
yeah, that was another thing, with this is that, I'm thinking for the person where they are presented with this thing to get on one or not. And it's so conflicting with research, with different opinions and stuff.
Yeah, but I don't think it's conflicting. I think it's conflicting if you find the source that agrees with you. Mm-hmm. Because then I think the problem with today's world is there's an equivalency of opinion, right? I could be somebody who spent 40 years studying this, right? Mm-hmm. Or I could be a TikTok influencer and say the opposite thing, and there's two opinions. Well, sure, there are two people saying two different things, but are we holding them at the same caliber? And I think that's the problem. No one asks, tell me every source that you're telling on this side of the debate with every source on this side of the debate. And do they match the same level of pedigree and understanding or like thought process that's gone into this? It's like, no, dude, that person spent like 3 minutes thinking about this and decided to say the opposite to get a rise out of everybody. So I think there are things that have a very healthy debate, but I think sometimes it's like in today's world, anybody that has a platform already has some level of authority. And I'm like, just because they have a lot of people that listen to them doesn't mean that they have a lot of authority in this specific subject matter.
Yeah, that's a new wave, right? You can call them health influencers, fitness influencers, and that kind of thing, right? And there does come he who has more followers, more numbers are deemed the expert because they have all these people, so they must know something. I understand that's not the case, but I guess because I'm involved in the internet a lot, I'm involved in this world a lot, so I understand there's many different ways you can get followers. I can be very controversial, and I have a better chance of going viral if I'm super controversial and say outlandish things, right? So I understand kind of the game of this. But the average person probably is not going to understand that, especially if they're just a passerby and this is the first thing that comes up on the algorithm, right? Yeah. And then it's going to keep feeding you that because it's going to learn, oh, he must like this type of stuff. Let me feed you more information on this. And so you'll never get to hear the other side. And so that's why I think that's a very interesting thing that's going to grow in the future in terms of, especially in health, because there's so many different opinions on a myriad of different topics.
And I think I tell this to my the patients that seek me out are of a different caliber a lot of the times in this. But if I have a car and I take it to a mechanic and I relatively trust the mechanic, and he's like, "Look, dude, you need to replace this belt and we got to put this fluid in." I'm like, you know what, man, that sounds great, but I'm thinking let's do a spark plug and then change this piece of electronics. He's like, but that doesn't really affect the thing that. It's like, nah, you know what? It's been my car for like 15 years. I really know my car, so I'm just going to stick with that. But thanks for your opinion. So, well, then why the hell did you bring it to the mechanic if you're just going to do what you wanted, right? Like, this is a person that does this thing. So we went from this like paternalistic sense of medicine where it's like, I'm the doctor, you better listen to me, to like this team approach of medicine where it's like, oh, what do you think? What do you feel? It's like many times in the world, the pendulum swings, and sometimes the pendulum swings too far, right? It's like, dude, I don't know how to fix a car. That's why I brought it to you, right? It's like, fix my car, please. It's like, yes, I'm intelligent in certain things, but not how to do this thing. So I came to you for your opinion. So the same way that the patients that seek me out in my clinic, they understand these are the guys that have $1,000 hour lawyers, right? It's like, all right, man, what do you think? I'm like, this is my plan. Here's my justification. Here's some data backing that up. He's like, cool, thank you. Like, let's get initiated with the plan. Because this is an understanding of, we have a job to do and we're trying to achieve a specific outcome. It's not about feelings. It's not about how you want it. It's like, dude, do you want to be healthier? You want to live longer? Let's do these things. Right. And I think and this might not be the best personality type for everybody out there, but I think that, if you're very type A driven person, it's like, let's cut the bullshit and just figure out what we need to do. And then we can move forward. Right. And it's like, dude, if you want to like talk about this for hours, go find somebody else. If you want to hear my opinion, you want to move forward, you want to figure out how to do this right, we'll do it. Again, it might be a little abrasive for some, but I think, those that understand and those that want specific levels of outcome and what they're investing in, they'll understand that.
Yeah, because ultimately, you're saving time and giving them their most precious asset is time.
Yeah.
And going back and forth, debating between 20 studies and meta-analysis and double-blind studies and what was the parameters of this and all that. It's a waste of time. And a lot of times people are not interested in that. They're just not in it. They're just not interested in it. I guess the next area is one of the other, four horsemen that people like to talk about is cancer. And now with full body scans now, what's your opinion on those?
Yeah, it's a very tough topic, because this is probably one of the most double-edged swords that we have out there, right? There's two rules of cancer. One is don't get cancer, and two is catch it early. So with that, right? So let's just say that you're like, okay, I'm perfect with the current construct of healthcare. I do everything my primary care doctor tells me. I get all of the right evaluations at the time. I got my colonoscopy, I got my mammogram. I did what they told me to do. So in the US, how many cancers would we catch out of 10? Just pick it. Like, how many do you think we catch out of 10? 1 out of 10, 2 out of 10, 5 out of 10, 7 out of 10 with our basic sets of evaluation?
Early enough, probably I'm going with 3.
Yep, it's 3 out of 10. So we catch 3 out of 10 cancers. The other 7 go undiagnosed. It's not until you develop symptoms that you actually understand that a patient has cancer. So now it's like, okay, so I have a patient who is an executive, and he's like, all right, he's had family history of cancer, and he's very concerned about this. So I said, okay, we'll get a full body MRI scan. Now this will show us, if you did a full body MRI scan to the extent that you wanted to get every part scanned to its entirety, it would take 8 to 10 hours in a tube. No one's going to sit 8 to 10 hours in an MRI tube. So the whole premise in their intellectual property relies on the fact that they scan things quickly in certain areas just to get the very base levels. Okay. So now you don't get the clarity that you might not always get. So then let's just say we scan you and you say, oh, Julian, you got a little something in your lung. You're like, it's just a little bit big for us to ignore. We can't repeat it. We got to stick a needle in there to make sure it's not cancer. We do the lung biopsy, and we're like, you developed a pneumothorax. I'm sorry. All right, you're going to have to stay in the hospital. It's like, oh, God, it's really not resolving. We have to put a chest tube in. And it's like, oh, the chest tube resolved the pneumothorax, but now you've got an infection. And it's kind of inside this pleural space. We're going to have to give you IV antibiotics for 2 weeks. Oh, the report on your biopsy came back. It was a calcification. So you would have lived and died with this thing for the entirety of your life. And then you went through 2 months of hell because of this MRI. Or you catch cancer early. So it's like, it's such a dichotomous thing that it really and I think this is the utility of physicians like myself that understand these technologies well and are really partnering with patients, right? It's harder if you're just a guy off the street that's like, I want this test. You get the test, and then you're like, you get these 8 pages of reports and all these things. And it's like, now with ChatGPT, it can help you discern what's serious and what's not. But even then, right? Without that distinct level of knowledge, it's still harder for you to interpret everything with that, true depth of analysis you probably want in something as important as this scan. So do I think it's useful? I mean, I've gotten one, and it showed me some things that have changed my lifestyle, right? It showed that I had the very faintest amounts of fatty infiltration on my liver, right? Non-alcoholic fatty liver disease is on the rise. And I'm like, well, guess who's not drinking booze much anymore? So now I drink booze maybe once a year, twice a year. Because it's like, I'm not going to even mess around with that possibility. I know that booze is not great for me anyway, but that was kind of the kicker to be like, dude, stop. So now it's not only will it help with cancer, but there are other things. I've noticed advanced degenerative joint disease in my knees. I'm like, okay, well, I better start being better about leg day and making sure that I'm doing the things to preserve my joints. So now it actually shifted the way that I view my fitness journey to say, I need to do more joint preservation management type things. So now what thing has been, framed as a cancer detection tool is really another health optimization tool, because I'm like, hey, let's use it for all that it's got. It tells us the size of your prostate. We can understand a little bit about your thyroid. we're not going to get true joint understanding. Like you're not going to replace the knee with this MRI, but you get some cursory level understanding, which really helps kind of craft a more detailed and personalized plan for all my patients.
Yeah. I've been thinking, just me personally, about like I'm really big on language, and a lot of times how we describe these tests, sometimes it feels so heavy and almost intimidating and scary, right? And something like that, right? Instead of saying this is a cancer detection tool, let's just say it's a health optimization tool. It's something that's going to help you improve your behaviors, motivate you, inspire you more to do your behaviors. And that's just the weight is taken off of that, because we have this stickler when we hear the word cancer. It conjures up all these feelings and stuff. And everyone's family has probably been affected in some form or fashion on that. And then you start thinking of these things in your thoughts. And as we know, our thoughts influence our health. And so, to my understanding, with the AI ones, are those a little more sensitive? Is that why sometimes?
No, I mean, there really isn't like an AI full body MRI per se. They're all just traditional MRIs. Sometimes they do have they run a little AI regression on top of it to help with the detection of things. So radiology has two distinct parameters, right? So full body MRIs basically do the scanning, and then a radiologist will read it. But then you can also have an AI read it as well, because the same way that the Cleerly Scan uses CT coronary angiogram as the base, Cleerly is a layer that's added on top. This is an AI layer to help augment its ability that might have been missed by the human. So some of these have an additional AI layer on top of it. A lot of the times, the problem is the AI layer might start overdiagnosing. And that's really the kicker, right? Because in this thing, we want to be more sensitive to overdiagnosis than not, because we probably are going to have a lot of incidental findings that you would have lived and died with. And we want to be more cautious, right? Because there's sensitivity and specificity. So we want to drop the sensitivity a little bit and make sure that we don't just call everything, and then the patients get super upset and concerned about this.
Yeah. And that's the thing. A lot of times now, people can get so many, so much data, right? I can do my, I can do my true age test, right? I can get my genetics done. I can get my microbiome. I can do a full body blood work, and so you have all this data now, right? And so I like it because it's like a game to me. Yeah. But I can see how to others it could just be like, oh my goodness, right? And plus that's why guys like you exist, right? And
I mean, why do people with lots of wealth have wealth managers, right? Because they need somebody to do something with all this. I don't have time to deal with all this money sitting there. I need it to work for me, right? I don't have all this time to deal with my health data all the time. I need my health data to work for me. Well, I'm your health manager, right? I'm the guy that's going to take this and then codify it into something that's utilitarian for you and say, okay, all right, man, this doesn't look good, but you better stop drinking as much on Tuesdays. Let's figure this out, right? So there's definitely a way. It's funny you mentioned true age and things like that. So I used to do a lot of epigenetic testing, and I realized that technology is just broken. It's I haven't found any single clinical utilization for that. I was so hopeful that this would be such a cool talk. I mean, I actually, I don't know if you've heard about the drug rapamycin. Yeah. So, I mean, I have patients on rapamycin. I took rapamycin for a little bit, right? Because for everybody that doesn't understand, rapamycin is a drug that has been considered the anti-aging drug. There are epigenetic changes and methylation changes that occur on our DNA over time as a signature of aging. And the idea is that rapamycin could help revert some of these changes. And so in a calendar year, you would age 1 year, while on rapamycin therapy, you might only age 0.7 years biologically within that same time frame. So the idea was that these tests and these interventions could have a way of intervening and monitoring along that path, but there's been no correlation. I mean, there's still people that are on mTOR inhibitors like rapamycin to extend their life, and I mean, I know of a guy I met last month who's running a fund for $300 million specifically just looking into all of these different mTOR inhibitors. So it is a huge play by pharma to try and get in this, because we understand that there is a medication that will literally slow our rate of aging, right? And so that'll probably be a big new push in the next 10 to 15 years.
Yeah, I started to, kind of get rid of some of the ones the assessments and tests as well. Because, I was thinking, I was like, how much does it really move the needle? More than I like these things, and is it really as effective, or is it doing more good than harm? So I've kind of started to reassess some things as well in the arsenal. So speaking of that, what are some other, I guess, tools in your arsenal now that you are I guess, non-negotiables that you're going to use?
Yeah, I mean, the non-negotiables, I think everybody knows, right? Exercise is the most important longevity tool that we have. Like, get up and go exercise. That's number one. Sleep. We sacrifice sleep for everything, and sleep is probably just as important, if not as important, as exercise, right? We spend a third of our life doing it. Sleep, as we age, becomes more difficult to do well. More things affect our sleep as we age. Our hormonal release is not as good. So if you don't get at least 2 hours of deep sleep between REM and deep sleep, you're not releasing growth hormone in your fourth, fifth decade of life. So those are like, the massive important ones. You got to eat right, et cetera. But like, now if we're thinking about ancillary stuff, right? One of the things that I think is probably the most underrated and thing that I'm telling most of my patients to figure out how to get and see how they can convince their spouse or whoever to allow them to do it is put a hyperbaric chamber in their house. If you look at like every major athlete now, they all have hyperbarics in their home. It's funny because I just talked to a buddy who redid his kitchen and spent like 60 grand on his kitchen cabinets. And I'm like, dude, you should put a hyperbaric in your house. And he's like, are you crazy? And I'm like, yeah, you just drop like all this money on your kitchen cabinets. And it's like, that's not going to make you live any longer. But this thing that I'm telling you that will literally help you like be a 75-year-old that's skiing down the hill all day long with your grandkids, you're going to say no to, right? But to me, like hyperbaric is one of those things because as we age, one of the biggest problems is our joints, right? Like we define our quality of life through our independence. Independence comes from movement and ability to do the things that we want to do. And if our joints don't allow us that, then we're kind of stuck and we lose a lot of what we want to be able to achieve. And so as we age, our tendons are the most poorly vascularized structures in our body. And when you get in a hyperbaric chamber, you increase the oxygen tension and you increase the pressure. So now you're getting red blood cells to areas that they didn't have before. So the healing and regenerative properties becomes increased. And, I get my patients to do PRP and stem cell and exosome therapy and all these other things. So then it's this synergy between these modalities where it's like, okay, well, what happens if you did red light therapy, but you do photobiomodulation, you do stem cells or exosomes, and then you do hyperbaric? Okay, well, now you have a really powerful complement of tools to address a specific thing. So for me, it's like, it's not really a specific, intervention, but it's like, how do we take these and use them synergistically to get the most efficacious outcome that we're looking for?
Mm-hmm. Yeah. When you go about exosomes and stem cells, is there a certain, I guess, each patient's probably going to be a little different in terms of how much they're going to use, right? And
yeah, and it's really it's kind of a more nuanced conversation too, because exosomes and stem cells technically in the US are a little bit like of a gray area.
Yeah.
But, a lot of this is they've had things where we're getting to a point where it's a chronic problem. The traditional methods of like physical therapy and exercise have kind of fallen to the side. And now we're like, look, in a few years, you might need surgery. So this is the Hail Mary to see if we can prevent any type of surgical intervention or delay that to whatever extent we might be able to. So I'm like, we throw the kitchen sink. Because what is it like? And so it's really a time, money, resource thing. Because one of these interventions I'm doing with my patient, we might have to fly to Antigua to go, right? And then it's going to cost another like 5 to 10 grand on top of that, right? PRP, if you need 3-4 sessions of that, $700-800 a piece, you're looking at $2,500, and that's not always covered by insurance. So all these things for me, if it's a joint issue, I'm like, give it as much and as hard as you can, because the idea is you're just giving substrate for the healing process for it to innately occur. So as much time and energy and resource you have to devote to this until it gets better, keep trying. Otherwise, what's left, right? You're going to do surgery, or you're just going to limit the mobility through that joint space.
Yeah. And to me, that's still a more expensive option.
Yeah, it's definitely more expensive option. But I read, Bill Perkins Die with Zero, and I tell all my patients, I'm like, okay, you're 88. If you have an extra comma in your bank account or like another $400,000, what does it matter? Like, what are you going to do with that, right? Everybody says Warren Buffett would give all of his wealth to like revert back to the age of 40. It's like, when you have all of that, then what is the point? It's all about now. Like, invest now, right? And it's like, yes, it's expensive. Everything's expensive when you look at it, because you're only looking at it as something that you're like, I pay all this money for health insurance, I don't want to pay this on top of it. It's like, no, dude. It's like, screw the insurance, screw everything else. It's like, It's like, we don't care about the baseline. We want what we want because we want that best outcome for our life. And as you said, like, we only think about the most important commodity is time, but it's really not just time. Because if I gave you 5 years bedridden and you're hemiparetic, you wouldn't care. You're like, hell no, man, I don't even want to live like that. It's time plus health. And that's the most important commodity. And that's what I tell patients. I'm like, this is what you're investing in with me, with other practitioners like myself. I'm going to give you a commodity that nobody else can, because I'm going to give you time and health. And it's that you're like, then I should be like, then I'm like, I'm charged twice as much. You know what I mean? It's like that. It's like, then money shouldn't even matter. And that's what I try to tell my patients. Stop thinking in this myopic view of what I'm spending too much. It's like, no, it's like what you could possibly achieve. That ceiling is so much higher. Most people, they give you money to get more money. You give me money, I'm going to give you this different type of thing.
Yeah. I learned this lesson probably in my 20s. I've been consistently exercising, eating, blah, 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 all that stuff, right? Pretty dialed in since I was 20 years old. And, I think about some of my brokest days, and I would literally still eat well, and everything else would just look like nothing, right? I would go without clothes. I'll wear old clothes, old shoes, whatever. But my food and all that is going to be dialed in, like my health behaviors and all that stuff. That's a non-negotiable. No matter what, the rest of the budget, everything else can get slashed. But that's what
you're definitely in the minority, dude, because that's not how most people will work.
Yeah.
It's like, they'll be like, no, my gym membership's the first thing to go.
Well, I think it is. I think the lesson somehow I saw my father who was sick and suffering. I saw my aunts and some of my other ones, right? And that just stuck in my head. And then I think I went to a doctor one time and they said, yeah, probably around 30, you're going to have, diabetes and stuff like that because everybody else in your family. And I was like, I don't really like the sound of that. That doesn't make sense, right? And it just didn't make sense. And, that led me to medical school to a certain extent. And then I left, but still, that thing just didn't make sense that, like, my genes weren't my destiny. That whole notion. I didn't know about epigenetics then. I just knew that doesn't make sense, that everything's predetermined for me already.
Yeah.
Yeah. So to go out of left field here, I have a random question. What do you think is maybe one or two of the biggest misconceptions people have about this new age of medicine?
I don't like the moniker longevity, anti-aging. It seems, kind of like snake oily, where it's like, oh, what are you going to try and sell me now? This new supplement that's going to be like this, or some new private. And I'm like, no, man, I'm going to tell you to do the basics. I'm going to utilize a system that we already have in place, and then put you within that and optimize your health, right? And I think that's kind of the biggest thing, is that the misconception is that, like, we're out here practicing this crazy stuff. And like, some of these things that we do are pretty out there relatively, but a lot of them are really expensive. So it's like, it's easy to just, not give them much credence. But, once you look back and you peel away some of those things, it's like the core of what we're doing is, we're not going to do annual follow-ups. We're going to do every 2 to 3 weeks, man. Like that is a huge change, right? Like, the misconception is like, I see you, I take all your money and I give you a bunch of these drugs and all these other things. It's like, no, it couldn't be further from the opposite. I'm just, like I said, your health manager, your health coach, like, that data aggregation tool, right? And it's supposed to be this, like, really conductive layer between you, your health, and your data. And how do we get all that together? And that should be us. And I think that's what, this medicine that we're trying to purport really shows.
Yeah, I pretty much said I am sometimes I'm pretty much a curator, or maybe kind of helping lead an orchestra. That's pretty much kind of how I describe it, because you're absolutely right that the thing I want the field to make sure. Now, listeners, I might use longevity or anti-aging in the titles. That's for search engines. I share a sentiment as well, just to put that out there. But you got to get them in somehow, right? You got to get them in. Like, it's like the guy, I remember as a young boy, he had a really nice car. And I asked him what he did to get that, what he does. And he told me, he started talking about discipline and habits like that, right? And so you can lead with that, but then you're going to get the real meat of the material in there, right? But anyway, I sometimes I see in the field, I don't want people to swap being pushed out pills, maybe in a traditional healthcare system, for being pushed out a bunch of pills in functional health, or whatever you want to call it. That's the thing now. And so it's such a delicate balance, because some of the stuff is expensive. Some of it's useful. How useful? Who knows? What's the percentage, right? And that's kind of a personal call. And that's what you kind of got to explain to people, right?
Yep.
But some people, that 1% to 2% does make a big difference if you're really into it, right? It makes a difference if you're willing to pay that, but not everyone is. So that's why I think it's decentralized. It's almost like I almost think of it a little bit like Bitcoin in that space, right? I think health's becoming more decentralized and more choose your own adventure. Just make sure you.
Yeah. And I think that, I mean, everything is like becoming more decentralized. Education, right?
Yeah.
Like Harvard, or like even if you look at the early days of education, if you wanted to become a carpenter, you would have to go to the Carpenters Guild, and then the Carpenters Guild would teach you to become a carpenter, right? Fast forward to today, you want a degree from Harvard that gives you a piece of paper that you can show to the world that says, I graduated Harvard, which means if I come work for your company, then this is evidence that I will be a good worker, right? Yeah. Now the decentralization of that is you can acquire any level of knowledge at any time, and you could just show people with a portfolio of your work, here's what I could do. So now it's not about the Harvard institution. It's not about the Mayo Clinic. It's about, hey man, I got all this data with my health. How do I do it? It's like, well, you don't need to go to Mayo Clinic. We can just do it right here and we can figure this all out. So absolutely agree. Decentralization, like you're your own media company. You wouldn't have been a media company 20 years ago. The decentralization of media has been one of the biggest changes in the last 20 years as social media and all these things have occurred, right? So yeah, I think decentralization is happening everywhere. If we probably wouldn't be talking if I'd kept all my Bitcoin from when I had it earlier, but it's like, it's definitely like, it's affecting every sphere of our life. And I think it's great because I think it gives people more autonomy over the way that they can really, live their lives and decide who makes the choices that they feel aligned with.
Yeah. I'm sick to my stomach for but you get Bitcoin at the price you deserve, they said. And that's definitely true because I think it was around 10 years ago. Someone introduced me to it. It's like, you should get this Bitcoin. I was like, okay, what do you got to go do? Well, it's like, you got to go meet someone at the coffee shop. Because you didn't have Coinbase. You didn't
right.
Have, you didn't have Swan, none of these exchanges, right? You just had to go meet someone. And I was like, well, this sounds shady. I'm just going to go consume and I don't know, go buy another blazer or clothes or something. Because I was in New York and I had the biggest egg on my face. I was like, I wonder if that guy kept his Bitcoin. I wonder what he's doing.
Yeah, he's sitting at his private island somewhere, dude.
Yeah. Oh my goodness. But one of the last questions here is, what does success mean to you?
I think that's such a great way to end. When I started this journey, I just was sitting at one point and I was looking around. I was working as attending. I had a wife, 2 kids, a house in the suburbs, a nice yard, everything. I'm like, where is the sign? Where's the banner? Where's that endless sense of fulfillment and happiness that I've made it, right? And I'm like, I felt more empty at that point than I ever had. And it wasn't until this point now, right? Getting back to the idea of I wake up and I'm not like, oh my God, so upset about the fact that I need to like get up and do my work. I'm excited. Like my work gives me energy. And I think to me, that's it. Like find purpose and find something that gives you energy. And to me, that defines success because now I feel aligned with the things that I do. Before I was making money for somebody else. I was seeing patients I didn't want to see. I was in environments and talking to people I didn't want to talk to. But now I've removed all that. I talk to the people I want to talk to. I talk to the patients I want to talk to. They inspire me to do great things. And so now just living this life where I get to kind of define what I see as purpose and happiness is really, made me feel like I'm successful now.
That's a great way to end it. Where can listeners find you at?
So our website's at www.lv8.health. And, my Instagram is Dr. Anand, Anand, Pat, Pat 84. And so either one of those sites, you get a lot of information about what it is we do, a lot more information about just our longevity tips and tricks and things like that. And if, any of your listeners want to reach out, feel free to reach out through the website. We have a form there and be happy to answer any questions they might have.
Awesome to hear. I will have all his information in there. And I'm going to end this a little differently. I'm going to share some of what he wrote on his Instagram. It was a nice plane that you're in, by the way. I'm not going to share it all. I'm just going to share a little bit of it. He said, leaving behind comfort and complacency is never easy. You venture into something new, burdened with the rock of inertia, striking it day in and day out, years of worry, months of despair, insights of abject failure, until one day a crack emerges and the cumulative weight of your efforts is felt. Success now seems like an eventuality and not some distinct, intangible goal. So listeners out there, keep pushing, keep striving, keep building, stay awesome, be limitless. And as always, optimize today so you can lead tomorrow. Peace.